Hey there, I'm here to talk about something really tough, beating drug addiction. If you're listening to this, you might be facing one of the biggest challenges of your life. But guess what? Recovery is not just a dream, it's absolutely possible, and I'm here to guide you through it. First things first, let's get real about addiction. It's a disorder that goes deep, affecting the brain and messing with your decision-making. This isn't just about lacking willpower. It's about how your brain has been hijacked by substances that give you a false sense of happiness. Now, you might feel like you're in a never-ending chase for that high, but it's a chase that leads nowhere good. The more you use, the more you need, and that can spiral out of control pretty fast. But here's the hopeful part. Many have walked this tough path and have come out stronger on the other side. You can too. Whether it's through therapy, rehab, or even methods like hypnosis and affirmations, there are numerous ways to tackle this beast. The hardest step is often recognizing you have a problem. If you're here, listening to this, you've already taken that brave first leap. That's huge. Acknowledging the problem is your stepping stone towards a drug-free life. Remember, addiction thrives on denial. It's what keeps you trapped in that destructive cycle. But by choosing to confront the truth, you're wielding your power to break free. So are you ready to reclaim your life? To let relationships, career, and happiness take center stage again? Let's do this together. Start your journey to recovery today, and remember, you're not alone. There's a whole community here cheering for your victory. You've got this.
Substance abuse and the evolution of dependency are issues that can affect anyone, from suburban mums hooked on sleeping capsules to teenagers swayed by peers to try cannabis. Adolescents and young adults are considered to be particularly vulnerable. This might be because these are critical periods of transition and change, and it's often during these transitional times that individuals begin to experiment with new things and face new life stresses. Knowledge is power. Individuals are also at a higher risk if they're feeling down, have self-esteem issues, carry a family history of drug abuse, or feel like they do not fit in with the world around them. What drugs are commonly abused? Let's take a look. Intoxicants, including alcohol, cannabis, also known as marijuana, methaqualone or mandrax, diacetylmorphine, better known as heroin, flunitrazepam or rohypnol, methylene-deoxymethamphetamine, commonly referred to as ecstasy, O-methylmorphine or codeine, various anti-anxiety agents, lysergic acid diethylamide, also known as LSD, methamphetamine or crystal meth, amphetamine, often called speed, benzoyl methylecgonine, known as cocaine, appetite suppressants, cough mixture, inhalants, and prescription pain or sleeping medicine. Each of these substances can lead to a diagnosis of drug dependency. Prescription pain or sleeping medicine often leads to the diagnosis of drug dependency. This issue is commonly identified when the substance abuser seeks help or when an interested family member encourages an appointment with a general doctor, drug counselor, or psychologist. If you choose to seek help, you can expect to be asked several questions about your substance use and any troubles you might be experiencing. Questions may include whether you've ever tried to, or felt that you should, quit or cut back, if you experience any shame or feel that you might have a problem, or if you have ever used substances as a way of grappling with life's issues. Many people who have experimented with substances or use them frequently will recognize when infrequent drug use becomes drug abuse and dependency. However, self-denial is really powerful and can blind many individuals to the reality that substances are becoming a problem. Substance abuse and dependency can be recognized by the following signs. Feeling that you need the drug on a steady basis, ensuring you have a continuous supply of the substance, and acting in uncharacteristic ways to use, such as theft of money, lying to family members, or turning aggressive when something stands between you and your next drug-taking opportunity. Other signs include feeling lost when trying to deal with life's issues and stresses without the help from your substance of choice, repeatedly failing attempts at quitting your drug use, developing a tolerance toward the substance, and placing yourself and/or others in danger when under the influence, such as driving while intoxicated or engaging in other hazardous behaviors, including unprotected sex. There's also a decline in quality in relationships, work performance or financial position, frictions with authority, the police or other legal issues, and excusing use with phrases like "everybody does it," "need it to relax," or "it's only sleeping pills/marijuana." The factors in the evolution of drug addiction include genetic elements. Drug abuse as a whole appears to run in families, and studies have shown that dependency has a genetic component. While environmental factors influence whether someone uses substances, misuse and dependency are largely influenced by genetics. Poor coping and self-medication are also significant. Many individuals turn to substance abuse as a way of escaping from unpleasant feelings like depression, stress or anxiety, and it becomes a method to cope with stress. Others use substances as a form of self-medication. For example, an individual suffering from social anxiety might use drugs to become less inhibited and more outgoing in social situations. Regarding the highs and lows, different substances have different psychological effects and produce different mood states. For instance, cannabis is often used as a relaxant, whereas cocaine is a stimulant drug and is commonly used to induce a state of vigor and euphoria. These sensations are enjoyable and serve as positive reinforcement. People continue to use substances to recapture this enjoyable high. Conversely, what goes up must come down. There comes a point in substance addiction where it takes more and more to achieve these enjoyable highs, and so more substances are ingested. The more drugs that are consumed, the harder the fall afterward. Some individuals enter deeply painful and depressed states, and consuming a lot of drugs is often seen as the only way to alleviate these unpleasant feelings. Societal and cultural factors also play a role. Many youngsters are exposed to the theme of substances at an early age by their parents, siblings, peers, and the media. Those who have had substance misusing parents are more likely to use drugs themselves, as are those whose social peer group promotes the theme of drugs. Additionally, cultural values place different emphasis on the perception of substances.
In order to breach the cycle of habitual drug use, drug-dependent people must make crucial changes in their lifestyles and mental attitudes, and commonly need help in doing so. Behavioral and psychosocial treatments are the foundation of services available to assist substance abusers accomplish and maintain meaningful periods of abstention. Opiate drug users oftentimes get treatment in methadone plans, where behavioral psychosocial therapies are blended with a medicine to control heroin use. Their additional illicit drug utilization, particularly cocaine, is frequently a primary objective of behavioral interventions. Research has now shown that substance abuse counseling with abstinence inducement processes and access to psychosocial services is an active component in the treatment procedure, and that more services brought about better results. Among patients in a methadone upkeep sample, 90 to 100% who got psychosocial services and incentive processes were abstinent from heroin and cocaine for as long as 8 weeks. Only 30% of patients who got methadone without services lived abstinent. Incentives may be an effective way to incite abstinence from illicit drug utilization. In one field of study, 32% of methadone patients laid off all illicit drug use for prolonged periods of time when provided the opportunity to get methadone take-home privileges coming after drug-free urinalysis test results. Only 8% of controls laid off drug use. Take-homes are the most potent reward available in the regular operation of methadone treatment plans. In a different study with cocaine misusing methadone patients, the opportunity to obtain retail items from the program incited 47% of heavy cocaine substance abusers to quit using cocaine for lengthy periods of time during treatment. Only 6% of controls laid off utilizing cocaine for any meaningful length. Treatment of primary cocaine substance abusers relies totally on behavior and psychosocial therapies, as there have been no effective medicines brought out to date. Community reinforcement therapy is a mighty new behavioral treatment for cocaine misuse. The treatment blends couples counseling, recreational therapy, and physical incentives, retail items, that help to incite abstinence. The treatment holds patients in treatment, for example 58% retained for 24 weeks likened with 11% of controls, and boosts long durations of maintained abstinence. Relapse prevention therapy, which instructs patients to realize high-risk situations for drug utilization and to go through coping techniques, has likewise demonstrated promise for treatment of cocaine substance abusers. Rates of retentiveness and abstinence have been better for relapse prevention than for control therapy in 2 studies. A lot of smokers who would like to quit prefer to do it on their own, without any professional help. All the same, less than 10% of smokers who attempt to stop succeed on any given quit try. So attempt to stop 10 times and you ought to get it right once. That's a joke. But perhaps. Inquiry has identified particular physiological, psychological, and environmental elements that lead to relapse versus successful abstinence after stopping. Treatments may be tailored to address these components. Research has demonstrated that the most effective technique for smoking cessation blends nicotine replacement with patch or gum, and behavior modification that teaches patients to realize high-risk situations for smoking and to carry out coping strategies. 30 to 40% may accomplish long-term abstinence with this plan of attack on a given quit attempt. Smokers with a chronicle of depression have a particularly hard time stopping. Research has now demonstrated that these smokers may benefit from a particular mood management therapy in combination with nicotine replacement. Among the most crucial things in addiction treatment and recovery are drug rehab platforms. These are places that you are able to go to in order to get assistance for your drug addiction. Drug rehabs are going to supply you with places that you are able to go and remain while you get sober. These are great for you as there's no way to get drugs in drug rehabs, and so you've no alternative but to get sober in one of these places. There are medical individuals on staff in drug rehabs, so that while you're undergoing withdrawals, they may be on hand to assist you through it and to make certain that your body is going to be able to come through eliminating your drugs. They may help you in a lot of different ways, and you are able to feel secure and safe about checking into drug rehabs, as they won't let anything happen to you when you're going to get the substances out of your system. Drug rehabs are crucial to your recovery, as they allow you to stride away from your life for a little while and center on merely becoming better. You won't have to fret about the everyday tensions of your life for a while, and you are able to center all of your energy on merely coming through your drug dependency. This is really helpful for many individuals, as it lets them be able to view their lives from the exterior, and there are occasionally matters that they're able to see about their lives while they're in treatment that they would not differently be able to see if they weren't in treatment. Substance rehabs are likewise crucial to drug dependency recovery, as they'll provide you the tools and the means to work out why you're addicted to substances. First of all, you're going to be able to make batches of different decisions about why you turned to substances, and through these conclusions you're going to be able to work out what it was that made you need to become a substance addict, or what guided to your drug dependency. You'll be able to realize these matters in your life, so that when you're no longer in treatment and you have to contend with these same topics, you'll be able to make more beneficial decisions and ward off the traps that might lead to retrogressing into substance abuse. Drug rehabs provide individuals the tools that they require to deal with the emotions that may commonly lead to substance abuse. If an addiction recovery individual may learn how to deal with tension and emotions like rage and sorrow without utilizing drugs, then when they're in recovery and are confronted with these same emotions, they'll be better able to address them. It's really crucial that an individual becomes cognizant of different methods to deal with these emotions, as it's frequently these emotions that lead individuals back to drug abuse, even after recovery. Drug rehabs are likewise going to bear services for loved ones and friends of individuals with substance addictions. There are going to be meetings that loved ones and friends may attend, in which they'll hear all about what their loved one is experiencing, and they'll likewise learn ways to cope with their loved one and how to support them when they're in recovery. These meetings are really crucial to recovery, as it's frequently deficiency of support that leads somebody back to substance abuse. Drug rehabs will likewise bear out patient services that you yourself may go to while you're in recovery. These meetings and counseling sessions become really crucial in order to keep you clean and sober, as they're places that will supply you with the support that you require. How to back up recovery. Support yourself first of all. Support and love from loved ones and friends is a vital part of the recovery process. Support for the loved ones and friends of the recovering addict is of like importance. That's why addiction groups have developed to help outsiders comprehend the addiction and how best to back up the recovery process. It's crucial for them to comprehend that they're not at fault for their acquaintance or loved one's addiction. Step in. Frequently, the support of friends and loved ones is most required during the beginning step of the recovery stage, admitting there's an issue and seeking professional help. This may take the form of an intervention, where friends and loved ones get together to present a unified presence of love and concern for the addict in a non-confrontational fashion. This procedure may likewise take the form of appealing from loved ones, or even ultimatums, if the state of affairs gets bad enough. Read everything you are able to on addiction and the recovery process. This will advance your understanding of what the patient is going through in detox, counseling, and treatment. It will likewise help you comprehend best how to offer support during the aftercare stage, after release from the recovery treatment center. Don't label, don't enable. Never quit expressing your trust in the patient's power to recover from an addiction. At the same time, be steadfast and let them understand you care enough to hold them accountable. You are able to do this in a non-judgmental, loving fashion. Abstain from substance use and from bringing up substances in conversation. Think about attending religious services together or becoming involved in a voluntary service project or community education class. While remaining busy is a great distraction, attempt not to overdo it, as the patient will still be working on a lot mentally and emotionally during aftercare. Use a male clear American voice for speaker 2. Add clean subtitles with outline. Don't use iStock. Use YouTube Audio Library only. These days, recreational drugs are the major drive of drug addiction in society. And apart from these sorts of drugs, prescription medicine likewise possess habit-forming properties. When an individual takes any substance, the chemistry of his or her body will alter. For instance, if you have a headache and you consume an aspirin, commonly the infliction will disappear. And if you consume recreational drugs, they'll commonly bring about a feeling of euphoria. After the personal effects of a substance wear away, the user might be enticed to consume more of it to go through the same effect once more, even if they had a headache and it has not reoccurred. When you truly like the effects of either recreational or prescription medicine, then you might potentially become drug addicted and hooked on them. Individuals who become addicted will commonly decide to stop their drug dependence when they recognize the negative outcomes the drug is having on their life story. Drugs might greatly impact them physically and hide their real personality. Commonly, this is what is seen with tranquilizer and antidepressant drug use. There are likewise a lot of damaging side effects like fatigue that might be experienced by those who attempt to kick their substance abuse habit. If you've been utilizing recreational drugs on a steady basis, always remember to confer with a physician before you attempt to quit taking them. For your own safety, drug withdrawal from substances need to be supervised medically in most cases. Physicians may likewise provide you a support network that may help you in your fight. Hypnotherapy may assist those of you who don't wish to consume recreational drugs any longer, but most times it's safer to look for professional hypnotherapists who specialize in that field. Ask a professional hypnotherapy association to discover their members who have been schooled to deal with your own specific state of affairs. As you discover the correct hypnotherapist, talk to him about your fears regarding the treatment. He will assess your needs and deal with the resolution of problems that induced your addiction. He will likewise help you boost up your self-respect and build up your strength as you go through the treatment. Make sure that when you're addicted to recreational substances, you always ask your physician's guidance first before you undergo hypnotherapy. Bringing the use of prescription medicine or illicit drugs to an end isn't simple. It has to be executed slowly to let the body recuperate the chemicals that have been replaced by the substance. Through hypnotherapy, the elements that sparked your drug dependency will be distinguished and dealt with. Self-hypnosis can likewise support you in accomplishing your desired outcome. Hypnotherapy, put together with additional treatments, needs your full dedication to succeed, but they might well help you come through the transition more easily once you've determined to quit taking drugs.
If you're serious about laying off drugs, then you ought to earnestly consider utilizing the power of self-suggestion to alter your thought practices. With autosuggestion, you'll be able to program your subconscious with the fresh ideas, feelings, and behaviors that you wish for yourself as you get to be clean and sober. You can provide yourself some help with the steps of successful affirmation, suggestions for quitting substances, and reinforcing your new ego. This chapter will introduce you to utilizing affirmations to help yourself quit drugs. Affirm it. In order to be successful at utilizing affirmations, you have to have a clear-cut, step-by-step game design. You have to set a time aside where you are able to utter your affirmations aloud every single day for at least 1 calendar month. It's most beneficial to write your affirmations down first of all, and then as you learn them, you are able to narrate them in your own words. If you are able to state your affirmations aloud each day for more than 21 days, you'll discover this to be unbelievably powerful. State aloud so you are able to hear your own voice the accompanying, "I understand that I have got the power to quit drugs today. Consequently, I require of myself doggedness and ceaseless action towards the goal of laying off drugs now. I'm creating a promise to myself that I can and will stop." We today know that through the precept of affirmation and suggestion, the recurrent act of stating desire toward your goal will sooner or later become physical truth. Consequently, it's advised that you spend equal to 30 minutes each and every single day, and spend that time on considering the drug-free individual you intend to turn into. As you affirm your target of quitting drugs, make a clear-cut mental image of this individual you're turning into. As you rehearse this, you'll discover it works in a predictable style. As you continually and repeatedly bear in your mind the picture of your fresh self, you'll discover that you slowly and mechanically transform your reality in positive ways. Consequently, it's crucial to spend 10 minutes of every day requiring of yourself the self-control and self-assurance to quit drugs. In order to devote yourself even more to this procedure, make sure to get it down in writing. Put down a description of your goal to stop drugs and promise to never quit trying till you've developed the self-control to stop. It will be something you are able to go back to, particularly at those times when you feel like surrendering. In conclusion, you'll wish to remind yourself every day about some of the basic principles of affirmation. Simply recall that affirmations will carry on working for you as long as you only utilize them in fashions that benefit yourself and everybody around you. You'll sooner or later pull into yourself the outcomes, places, and things you'll need to utilize, likewise the cooperation of others. Remember to formulate within yourself a love for all individuals, and particularly love for yourself. You'll discover that individuals are more than willing to assist you, as you're the type of individual who's helpful towards other people. Carry with you your personal statement of affirmation at all times, and put your name to it. Make certain to commit it to memory and recite it aloud each day. Utilize your faith and your emotions, and you'll discover that you step-by-step influence your own actions, quit abusing drugs, and become a successful and self-governing individual. Remember the steps for affirmation. Provide yourself the most beneficial suggestions for quitting drugs, and make that a habit. You'll discover that you by nature produce a plan for quitting and follow that plan by utilizing affirmation and self-suggestion. Look into the numerous groups and organizations that provide support for those locked in fighting dependency. Think about counseling. Research the possibility that medicine might be in order. Dedicate to change. Arrive at a decision that reverberates a great want to fight and resist addiction. Take a decisive inventory of the matters that have to change to support the battle against dependency. Seek strength in faith. Find a higher power in life, but know that it is personally specified. Take control and recover power. Comprehend that change might be a hard and slow progress, but find the potential and power to perpetually move forward. Build or rebuild a set of values to help battle addiction. Make a list of what is most crucial in life, and then forge statements to announce the particular value. Think about accomplishment, health, responsibility to loved ones, self-regard, consciousness, and community as potential values. Spend a little time connecting with feelings frozen by dependence. Consider emotions, responses to various situations, and the feelings that come after. Expect to relearn how to cope with feelings.